Are you concerned about losing your hearing? Welcome to Talking with Docs. I'm Dr. Brad Wien.
And I'm Dr. Paul Zalzal.
We have a guest today.
Hi, I'm Olivia.
This is Dr. Olivia Ginty. She's an ENT resident. She's here today to talk with us about hearing loss, particularly age-related hearing loss, kind of how our hearing works, why it happens, and what you can do to try to protect your own hearing, because it's a really, really valuable resource. So let's start at the beginning. What's the basic anatomy of our ear? How is our ear made up?
Yeah, so our ear is designed to take sound waves and convert them into electrical signals in our brain that can interpret that sound. So our ear, the outside of the ear is like a funnel, and then it directs the sound waves into our inner ear by a canal. We have an eardrum that I'm sure you've heard of that vibrates and connects with the smallest bones in the body, 3 of them, that vibrate as well and convert that sound into vibrations, which then goes into the inner part of the ear. It looks like a snail. It's called the cochlea. And that's where sound is then transmitted into impulses that go to our brain. And that's how we hear.
Now you sparked our interest because you said there's bones in there, and we're
Yeah.
orthopedic surgeons, and you guys have the smallest bones in
Yes,
the body. We don't
yeah.
deal with those bones. We deal with the bigger bones in the body.
That is our claim to fame, the smallest in the body.
It's pretty cool.
It's very, very cool. And it's amazing, actually, how sound even works. Like that it come from outside and then go to your brain and allows you to recognize it and to process it. It's wild. Okay, so hearing loss is a big problem and a big part of an ENT doctor's practice, even a family doctor's practice. Why do we lose our ability to hear over time?
And so basically, when we lose our hearing, it can be for any reason along that whole pathway we laid out. But when we age, just over time, it's very natural that within that snail in our ear, the cochlea, over time, our body ages and it just doesn't work as well, especially at the more higher frequencies. So we tend to lose that when we age.
Okay.
If you're experiencing this, you are not alone. It is extremely common. Anyone over 60 or 65, I think it's 1/3 of people in that age group.
And I think it creeps to a half over 70, have some type of hearing loss.
So super duper common. Don't feel bad if this is happening to you.
And I would encourage you to leave a comment to let people know about your experience and what success you've had, because there's a lot of people struggling with this, and maybe people that don't even know that this is a problem, because they never thought, oh wow, maybe it is my hearing that's causing me to have difficulty interacting or whatever. So leave a comment.
That's a good point. It can be misdiagnosed. Is that right? Like, I mean, if someone has a hearing impairment and they don't know about it, and they come into the hospital for other reason, it can be mistaken for early onset dementia or something like that, because you think the person has some dementia when really they just can't hear what you're trying to say to them.
Yeah, absolutely. Yeah, the signs can be really subtle. A lot of people, as you're describing, might feel like they can't communicate as well and can be misinterpreted as other conditions. People will also find subtle signs like increasing the volume on their TV or having difficulty understanding others in crowds. And most commonly, we actually have family members noticing before the patient for that reason, and family members bringing the patient into the clinic to have their hearing tested. Yeah.
And the main reason that we lose our hearing as we age relates a little bit to the nerve and a little bit to the little hairs, the cilia inside of our cochlea. Is that right? But it's just a natural process, so it's not necessarily because of something that you did.
Yeah.
But there are some identifiable causes and even some things that we can do to prevent this from happening.
Yes, correct.
Okay.
And so the big one is noise protection. Okay. So particularly people that work with things that make a lot of noise, like airplanes or firearms, we do notice very specific changes in those people. For instance, if they're using a firearm with their right arm, it tends to affect their left side as it's closer to the sound. So it's very obviously correlated in those kinds of people that are using those activities. So we definitely encourage them to use appropriate ear protection for that. And that's the best way you can kind of prevent any kind of age-related or hearing loss in general within your cochlea is protecting your ears from noise.
I work with a person who makes a lot of noise. Does that put me at risk?
You know what, TJ, it's okay. One of our nurses, that's probably who Paul's talking about.
No, not a nurse. And it's true, it's in my left ear too.
Yeah, oh, interesting.
Rude.
Yeah.
What I would say too is that 30 or 40 years ago, we didn't know much about this. People on work sites or in jobs that had a lot of noise were not really protecting their hearing, but you are seeing a lot more of it, so awareness has certainly increased. And if I'm correct, it's not only how loud it is, but it's also the duration of the exposure, correct?
Definitely.
Is there a specific threshold that we're worried about as far as the amount of decibels?
Not specific. I would say it's certainly just over time how much you're exposed to as you're describing.
Right.
It's a volume. Yeah.
Okay.
So louder stuff over a short period will do damage. Less
Yeah.
loud stuff over a longer period will do
Yeah.
damage. So it's kind of like a pack ear smoking we talk about.
And I read something about, how loud should I listen to like my earphones or my TV? And someone said you should never go above 60 minutes of the maximum volume of that device for longer. Sorry, 60% of
Wow.
the
Yeah, I was
maximum
gonna say.
volume for more
Yeah.
than 60 minutes. So
Yeah.
you have to be cognizant of both the time and how loud it is. Okay, so when it comes to risk factors for hearing loss, and particularly age-related hearing loss, are there any things that are on the list that are common to other diseases? Like, yeah, guess what? This causes this, but it also causes hearing loss.
So, as we mentioned, noise is the biggest risk factor, but there are other things that have been cited in the literature as being associated, such as smoking, obesity, and poor diet. Those things that that are good for your other parts of your health.
Yep.
So it makes sense that it just affects one more thing in the body.
Right. Yeah.
Okay, so we mentioned smoking, elevated body mass index,
Yep.
cardiovascular disease.
Yep.
What else? We had-
Hypertension, diabetes, the way that it affects your
Right.
vessels, as well as the chronic exposure to high pressures, even chronic kidney disease is associated with age-related hearing loss, and, sorry people, elevated cholesterol. There is an association, likely because of all the other pathology that it causes and the way that it affects your vessels, but it has been linked to age-related hearing loss as well.
Okay, so again, lifestyle matters again for your hearing. I mean, I never would have guessed that before when we talk about lifestyle and what you can do with your lifestyle in order to improve your health.
Yeah.
And here's just another sort of body function that can be affected by poor lifestyle.
So obviously controlling all those factors is really critical, but what other things that can we do to reduce the amount of age-related hearing loss that we have over time, specifically with respect to protection?
Ear protection you mentioned.
Yeah. What are your guidelines for when people should use it? Because probably like, oh well, it doesn't seem that loud. It's only going to be for a short period of time. How do you decide if you use ear protection, and how do you decide what type of protection you use?
I would say you use a protection that you're going to want to use every day, that you're going to actually reliably put on. So earbuds that I personally have earbuds that are really nice quality and I like wearing them.
Yep.
And so I wear them more often when I'm on a plane or places where I know I'm going to get damage to my ear watching cars race. It's gonna be the ear protection that you actually use.
Yep.
And so wherever that may be, that's going to be the most ideal protection for you.
So the two main options would be in-ear and then over-ear types of
Yes,
ear protection.
yeah.
Would you say that they're both equally effective?
I don't want to endorse either. They're both like good for you.
They're both quite good.
Yeah.
Okay, if I'm at the Taylor Swift concert,
Okay.
should I be wearing ear protection?
Probably a good idea. Yeah.
Which is ironic. 'cause
Especially
going
if you're
to-
really up and close and
Where I would be.
And it's 3.5 hours the Eras
Yeah.
tour was. That's a long time to be exposed to loud Taylor.
Yeah,
But that's the
absolutely.
irony, right? You're going to wear ear protection when you're going to a concert to listen to music.
Yeah, absolutely. The other thing about it is a lot of people think, well, you know what? I have noise canceling headphones or I have noise canceling like earbuds. They actually do not protect you from the average reduction is about 25 decibels for over-ear and in-ear that are designed for noise reduction. But the general noise reduction headphones are actually not designed to protect you. They just reduce the ambient noise. So do not mistake those for something that's actually necessarily protecting your ear health. And intuitively, I would have thought that they would have been doing the same thing,
Active
but
noise
apparently
reduction.
it's not. Yeah, it's a different type of technology. Okay, other things that are known to cause reduction in your hearing loss. What are our thoughts about medications these days? I remember going through medical school. There's always a list of things saying, "Oh, watch out for ototoxicity, and this might damage your ears." Are there any medications that are well established to know to cause ear problems?
There are some specific medications that are just are higher risk for causing it. Certain antibiotics or certain diuretics, such as like blood pressure pills,
Yep.
or NSAIDs. Those are all sometimes linked to hearing loss.
Yep.
And depending on the situation, sometimes they are necessary, but they can be associated with those risks.
So the first one is aminoglycosides, like gentamicin.
Yes.
So, like you said, obviously, if you need them, we kind of have to just, unfortunately, we
it's
talk
that
about risks and benefits,
risk-benefit ratio.
right? So be aware, and obviously your doctor would give you the lowest dose possible for the shortest period of time.
I've seen that too. Like I've seen, because oftentimes we deal with orthopedic infections and we refer to infectious disease, and they do get on some of these antibiotics. I've had patients who've suffered from this kind of complication from certain antibiotics.
Yeah.
I mean, it's a thing.
Yeah.
So,
And what was the antihypertensive that you're mentioning?
Loop diuretics can
Loop
be associated. Yeah.
Okay. And then obviously anti-inflammatories. We talk about this all the time, primarily when we had a nephrologist on, they said, hey, really be careful for your kidneys when you're using these medications, so you have to be careful.
yeah, right, with ototoxicity. The good news is we brought your blood pressure down.
Yes.
Pardon?
Yeah.
It
So
happens.
the take-home message is here, everybody is going to lose hearing as they go through their life. We need to do everything we can to protect it, because once it's gone, there's no way to get it back. Is that fair to say? There's no rehab you can do. There's nothing that you can take. There's no supplement, regardless of what someone's trying to sell you, cannot get your hearing back. So you got to protect it, be on the front line, and then go from there.
One thing you mentioned earlier too, when we were talking about making this video, is you mentioned to consider hearing aids like glasses, right?
Exactly.
They're just something to augment that sense, right?
Yes, yeah.
A lot of people wear glasses, and we should sort of, if there is a stigma associated with hearing aids, we should try and remove that stigma, because it's really important to be able to hear your surroundings. And we've talked about in other videos, just for the risk of reducing age-related dementia, if you have a hearing impairment, that could accelerate dementia. So having hearing aids in can help minimize that risk as well.
One last thing I don't want to forget to mention or to ask about, when should we start testing our hearing?
Whenever you have a concern about your hearing, it's a great, audiologists are a fantastic resource.
Okay.
You don't need a referral to go see them. You can go to any clinic and get your hearing tested, and that will give you an idea of what's causing your hearing too, and give you an idea of where you're sitting, if it's normal, if you are starting to have some age-related hearing loss. That's the best way to begin to understand and
Okay, so that's the first one. So if you're having symptoms, what about if you're not having symptoms? Is there an age where we say, you know what, everyone should have a baseline hearing test so that, you know, when you get older, we know that it's going down or whatever? Is it considered like a reasonable screening test, say at age 50, or not really something that we do necessarily?
I wouldn't say that there's necessarily something there. Every person, when they're a baby, does get their hearing tested. There is a hearing screen that every newborn will go through. In Canada, that's our first line kind of defense in terms of beginning the process of checking for hearing across the population. But similar to with glasses, it's something that tends to be more focused on when you start to see those symptoms or have any kind of concerns.
Okay.
Yeah.
That's awesome.
Now, I'm sure you're going to get a lot of questions about things like cochlear implants or any surgical interventions. Maybe we'll have you on another time to go into all the details about all the other types of hearing loss. But that was a good summary of age-related hearing loss that I'm sure a lot of our viewers are experiencing. Thanks so much for sharing all that expertise and information with us. Now, I understand you're involved in a charity. Can you tell us a little bit about that?
Yeah, I'd be happy to. It's called About Face Canada. It's a charity that represents individuals with facial differences. And that means anyone with a facial difference, whether that's acquired, such as burns or things like that, cancers that affect the face, or they're born with it and it's congenital, like different syndromes that affect our face. There's many Canadians out there with facial differences, and it's something that I'm very passionate about being involved with and representing these amazing Canadians that live with these facial differences every day.
And we'll provide a link that describes it and provide the link for it so you can learn more about it, as well as you can donate if interested. Now you know, if you like this video, please like it, subscribe to our channel, leave a comment, share it with someone that you know that's losing their hearing.
And remember, you are in charge of your own health and your own hearing.
And thanks to Dr. Ginty for joining us again today.
Thanks for having me.
We'll see you next time.